Welcome to Knowledge on the Go, the podcast brought to you by the PI Collaboratives team at Vizient. I'm Shannon Hale, Performance Improvement Program Director here at Vizient, and your host for this podcast. Today we are talking about sepsis. Sepsis is a major cause of death and represents a substantial healthcare burden. According to the National Institutes of Health, sepsis accounts for 6.2% of total hospital costs in the United States. A medical emergency with time being critical, and according to the Centers for Disease Control, sepsis alone has a mortality rate of around 10%. However, if it advances to septic shock, the mortality rate increases to around 40%. In response to these statistics, Vizient recently hosted a performance improvement collaborative that focused on sepsis early recognition. Joining me today to share their experience is one of the collaborative participants, Amy Lorenz, Lead Quality Improvement Specialist at Covenant Healthcare. Amy, welcome, and thank you for joining us today.
Thank you, Shannon. I'm happy to be here.
During the collaborative, each organization chose a performance improvement project to ultimately enhance or optimize existing approaches or innovations that would help decrease the time for recognition of sepsis in the acute care patient. Could you give us a high-level overview of your project there at Covenant?
Well, one of the areas our project looked at was to identify and look into sepsis Center for Medicare and Medicaid Services, or CMS, guideline fallouts. We wanted to determine the root cause and determine a solution that encapsulates education and guideline reinforcement for all of our clinical staff.
And as you think about your project, what one opportunity would you say stands out as a key focus?
Well, we wanted to look at discovering effective methods to enhance ongoing education as it relates to CMS guidelines, which includes bundle compliance, and that was a strong focus for our work.
You know, I remember during the collaborative, you spoke about your sepsis awareness page. Could you tell us a little bit more about that?
Sure. Because there was an inability to ensure that our second shift clinical staff was receiving CMS guideline revisions and had an awareness of the key areas of the CMS guideline fallout areas, we wanted to have an online reference tool that all clinical staff on any shift could access to review CMS guideline revisions and stay informed on CMS guideline fallout areas and the availability of smart phrases.
That's a great idea. How did you decide what would be listed on that sepsis awareness page and what the layout of that page would look like?
Well, the decision was made to provide biannual CMS guideline revision changes and clarification of each change to assist all clinical staff, as CMS guidelines can be very confusing, as well as providing a monthly report out of our CMS guideline compliance, or we call positivity scores here at Covenant. We provide a summary of how many charts were reviewed in the month prior, as well as a breakdown of how many charts met CMS guidelines versus how many charts had a negative outcome. And finally, we also included a categorical breakdown of each fallout. And this allows for our clinical staff to review weak areas where a negative outcome occurred by category and pose questions to the core measure team in support of education in promoting that conversation.
That is fantastic. What type of education did you do for staff around the rollout of the sepsis awareness page?
Well, Covenant has a weekly newsletter in which the announcement was made about the creation of our sepsis awareness page, and a link was provided. And in addition to that, we have a sepsis steering committee and a nursing quality council where an announcement was made of the creation of our sepsis awareness page, and that link was also provided. A request was also made at each meeting to cascade this information to ensure that all of our clinical staff had knowledge of the sepsis awareness page, and direct contact information could be found on that page should any questions or concerns arise regarding sepsis on either shift.
That's fantastic. You know, one big common thread that we heard during most of the PI work in the sepsis collaborative was to include those that are doing the work that you're wanting to improve in the actual PI planning, investigating, etc. Was that something that you found helpful as well?
Yes, Covenant included executive and physician-driven support, and having their input strongly enriched our path during the sepsis early awareness collaboration and identified the key area that we needed to focus on surrounding the cascading of education and promotion of communication with all clinical staff on both shifts. Having that physician input establish a path of identification as to the lack of communication and cascading of information to our clinical staff. We found that the physician input also revealed weak areas that arise during the actual early identification of sepsis and supportive care that encapsulates those CMS guidelines. awareness was the root cause that was identified during the collaborative effort.
Fascinating. How is your sepsis data? How do you share that with staff?
Well, Covenant provides information on our sepsis awareness page monthly, which includes the biannual review of the CMS guideline revisions, smart phrase revisions, and links where applicable in the CMS compliance monthly score, breakdown of the total charts review detailing the positive and negative outcomes that reflect the CMS compliance monthly score obtained, and as well as the categorical breakdown of each fallout, which gives our staff a pretty key idea as to where our weaknesses are.
Wow, great to get that data out there in front of everyone. With all improvement work, there's always challenges. What were some of the biggest challenges that you experienced in your work?
The biggest challenge identified was the lack of education and awareness of the CMS guidelines with our clinical staff, and I mean both shifts. At Covenant, the majority of the patients are identified as septic in our emergency room or our ECC. However, patients that have a longer hospital stay become septic later in the admission, and it was determined by our physicians that they did not have a strong awareness or understanding of the CMS guideline requirements or the revisions. Attending the hospitalist group department meeting, as well as providing an avenue to contact our special core measure team with questions or concerns, has been instrumental in providing education, promoting that conversation, and clarifying misconceptions surrounding the CMS guidelines. Finally, the addition of additional physicians from various areas, such as infectious disease, were added to our sepsis steering committee to provide further input and concerns at these meetings to have a stronger understanding of any problem areas leading to a deficiency in the CMS compliance. This has actually bolstered conversation and provided some resolution options for discussion to improve our care for our septic patients.
Finally, what parting thoughts would you like to share with our listeners today?
Covenant works closely with each area if there is a fallout, whether it is a physician-driven fallout, lab, or nursing, etc. This furthers the opportunity to provide education and promote that conversation. The supportive measure, along with the sepsis awareness page, has assisted in promoting a higher CMS compliance score monthly, as well as identify weak areas that needed to be addressed.
Fantastic insight, Amy. I think all organizations can benefit from sepsis education and awareness initiatives. I really appreciate your knowledge on this topic, and thank you for joining me today.
Of course, it has been my pleasure. Thank you.
Our thanks to Amy Lorenz, Lead Quality Improvement Specialist at Covenant Healthcare, for sharing their story. And thanks to you for listening. For Vizient's PI Collaboratives team, I'm Shannon Hale. Please join us for more knowledge on the go. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com.